So my name is Andrew. I am a second year dental student here at the University of Toronto. And before this, I did my undergrad at Western University in MedSci. And I'm excited to take you guys along in a week of my life in dental school. Good morning and happy Monday. I just got an email online at 6 a.m. this morning that classes were canceled. But that does not mean we sleep in because we actually have a lecture online in 2 minutes. An idea of what we were discussing this morning in today's lecture, we were learning about different parts of a partial denture, their mechanics and the physics behind why they are designed the way they are designed, and basically how they work to provide comfort to a patient who has missing teeth. We just finished our lecture for the morning, and I wanted to take this opportunity to show you guys what our schedule looks like for today and what the rest of the week is supposed to look like. Alright, so today we were originally supposed to have a quiz in the morning, but obviously today, since it was a snow day, that didn't happen and that was postponed to next week. So instead, our professors decided to do speed run through the entire lecture across this 1 hour here and cut into our lab time because we're not currently in lab right now. And we are going to have another demonstration at 2 p.m. where we're supposed to have a more which is going to walk us through some examples of certain procedures that we were supposed to do in lab. So I'm currently in my second year of dental school, specifically in my second semester, which is usually notoriously known to be the hardest semester in all of dental school. So our schedule gets pretty packed. We have 8 a.m.s pretty much every day. And typically we finish around 5 p.m. So it's pretty much, 9-hour workday. If you didn't notice already, today is dedicated to really just one area of dentistry called prosthodontics, and this is where we're focused on ways in replacing missing teeth using various tools like dentures, implants, and bridges.
Yeah. Wait, mine tastes like the Alfie song.
I unfortunately didn't make
Really?
the
That's what it
sandwiches.
is? Yeah.
It's only one line.
Okay, so trigger warning, Anki. Yes, we still do Anki in dental school. So I'm currently studying endodontics for a quiz that I have in about 2 days. So endodontics is basically the study of any diseases or injuries that are related to the root canals of your teeth, or what we call the pulp. And so for this quiz, we are basically learning about ways in which we can fix a lot of these issues, including the instruments that we use, the procedural steps that we take, and the tooth anatomy of a lot of the different roots that we have in our teeth. Okay, so Tuesday mornings is all about orthodontics, and today we're learning about the facial growth patterns of the jaw and other facial bones, and how these growth patterns affect the positioning of our teeth. And then after every lecture, we have a seminar where we apply what we learned into real life cases. And this is an example of a model that we are looking at today. And this is a booklet that helps us evaluate the facial bone structures for our individual cases. Okay, so after ortho seminar, I decided to go home for lunch, and I was feeling a little fancy, so I made some lemongrass chicken fried rice. The lemongrass chicken I actually made a few days prior, and it was starting to get a little stale in my fridge, so I decided to liven it back up by making a fried rice out of it. Okay, good morning, happy Wednesday. It is 8 a.m. and we are starting off the day getting ready for a patient in clinic. So here I am getting changed into my scrubs and shoving my bag into my locker before heading over to the clinic. As second year students here at U of T, we are able to start doing cleanings on patients. And so here I am opening up my patient chart, reviewing medical history, reviewing their treatment plan before I get them seated in the chair. Also on the side, I am setting up the chair by putting barriers to maintain infection control. Funny story, guys. So as I was practicing on my typodont one day, I accidentally suctioned my tooth and I found it. This was 2 months ago. Okay, trigger warning again. These are real teeth from real people, and we are using them today in our endodontics lab to study the anatomy of the roots. Okay, so here I've placed the teeth on a template where I am going to take an x-ray of them in the x-ray room just over there. Even after a long day of clinic and lab yesterday, we get no mercy to another glorious 8 a.m. start to our Thursday. So here I am up at 7:44, definitely did not have time for breakfast. So this morning we are starting off in restorative lab, and here is a little friend that my lab partner David made. I don't want to bore you guys even further of more clips of me drilling, so I'm going to take this opportunity to share some tips and insights if you are also considering a career in dentistry. One of the biggest things that I recommend students doing if they're considering a career in dentistry is to definitely shadow a general dentist to see if the work that they're doing is something that you also see yourself doing in the future. So I definitely recommend reaching out to your own dentist or other community dentists in your area, or reaching out to dentists online to see if they are open to having you shadow them. Don't be discouraged if a lot of them ghost you or don't allow you to shadow them, because it is a very stressful job and there are a lot of liabilities. So just keep trying your best, trying to reach out to as many dentists as you can and trying to express more that you are trying to learn more about the profession. Another thing is that a lot of dental schools will have a lot of prerequisites that you need to take in your undergrad before even applying. So I do recommend going on the websites of the dental schools that you are interested in and seeing all the prerequisite courses listed and planning out the courses that you want to take early. And finally, one thing that I'm realizing more and more as I'm going through dental school is how much soft skill is needed to succeed in a career in dentistry. Dentistry is a lot more than just what your hands can produce, but it's also how you communicate with your patients, how you communicate with your team members and your other colleagues, and how you can problem solve on the spot. There are so many instances where things will not go your way, but it is how you communicate and how you problem solve that will determine if you will succeed or fail. So I do recommend getting yourself involved in opportunities where you can build those soft skills so that you will have that in your toolbox before coming into dental school. These past few weeks we've been working on something called crown preparations, and as you can see in the booklet, these follow very specific measurements. Here is some of the work that I've done over the past few weeks. At first it was really challenging because you're preparing such a small area of the tooth and you really need to make sure that you are leaving behind no rough surfaces, which is a lot harder to do because if your hand just slips the wrong way by even the slightest, you might be forced to start over. But just like going to the gym, the more reps you get in, the more you establish that mind-muscle connection, and things will get easier with time. Alright, welcome to Friday, TGIF, but it is no different from yesterday. We are starting off the morning again in restorative lab, and we are continuing on the projects that we were working on yesterday. This time for me, instead of preparing a crown, I'm actually going to do something called a temporization. So basically, after doing a preparation, we don't want a patient to be walking away with just a nub of a tooth, so we put a temporary crown over that nub before the actual crown is made and placed in the mouth. And this is the temporary crown that we just made. It's not meant to be perfect, but it offers a temporary solution for the patient while they are waiting for their actual crown to be made by the lab. The rest of the day was quite uneventful. We had a pharmacology lecture, as we see here, and a few more lectures that were online. And that pretty much sums up my entire week. So here I am back at home with my dental loops that I like to clean at the end of each week because they've been through a lot. Basically, these are like magnifying glasses that pretty much all dentists use so that they don't strain their eyes. And these tend to be very expensive, so I like to keep them in as great shape as I can. But before I sign off, I want to thank you guys for watching this video. If you guys are interested in seeing a little bit more of that, I do have a YouTube channel of my own. Link is in the description, so please check that out if you can. But other than that, I hope you enjoyed this video.